Unfortunately, there are countless emerging substances of misuse both in the U.S. and specifically within Illinois. The most widely known, and perhaps the most dangerous, are the fentanyl analogs. These include carfentanil, acetylfentanyl, and furanylfentanyl, among others. These potent synthetic opioids vary in potency and all respond to naloxone or nalmefene in an overdose situation. They are frequently encountered mixed or cut with other substances that may heighten their euphoric effects and increase the risk of use. Kratom, which is obtained from a tropical tree native to Southeast Asia, possesses an alkaloid called mitragynine. The leaves are typically ground and consumed as a tea or a capsule. Kratom is not controlled in the U.S. Drug effects are largely dependent on the dose consumed, with stimulating effects most notable at lower doses and sedating effects at the larger doses. Again, the primary active alkaloid, mitragynine, appears to have pharmacologic effects at opioid, dopaminergic, serotonergic, and adrenergic receptors. Reports of kratom dependence have been noted. Safe doses of kratom have not been established. Catha edulis, also known as cat, is a plant found in East Africa and the Arabian Peninsula. Its active alkaloid, cathinone, is a potent stimulant with amphetamine-like properties obtained by chewing the cat leaves. Cathinone appears to demonstrate reuptake inhibition of dopamine, serotonin, and norepinephrine. Its pharmacologic effect is likely largely due to dopamine modulation, since its stimulant effects appear to be attenuated when a dopamine antagonist is administered prior to cat's use. Another emerging substance is xylazine, which is a veterinary sedative and a muscle relaxant with little to no human data for use. It's an alpha-2 adrenergic agonist, similar to clonidine or dexmedetomidine. Additionally, xylazine inhibits norepinephrine transport. Xylazine is frequently referred to on the streets as tranq or zombie and is almost exclusively found as a cutting agent for heroin or fentanyl. As xylazine is not an opioid, it does not respond to reversal with naloxone or nalmefene. The most widely known adverse effects of intravenous use of substance containing xylazine are skin abscesses, ulceration, and necrosis. Psilocybin and its active metabolite, psilocin, are naturally occurring psychedelic compounds found in certain species of mushrooms, often referred to as magic mushrooms. Both induce altered perceptions, hallucinations, and changes in thought and mood. These compounds are being studied for their potential therapeutic effects in treating depression, anxiety, and PTSD. While the pharmacology resulting in the hallucinogenic effects of these compounds is not completely clear, it appears they exert their effects via largely serotonergic agonism. Toxic doses are possible, with reports of serotonin syndrome following overdose of this substance. An additional emerging substance of misuse is Salvia divinorum, and this is a plant native to Central America known for its potent psychoactive properties. The active compound, salvinorin A, induces intense but short-lived hallucinations and dissociative experiences. Salvia is often used recreationally for its hallucinogenic effects. Its legality varies, and its use has raised safety concerns due to the unpredictable nature of its effects. Its hallucinogenic effects are thought to arise from activity at cannabinoid receptors, believe it or not, among others. Another emerging substance, tianeptine, is a pharmacologic drug marketed in several European countries, but is not approved by the U.S. FDA. Tianeptine is structurally similar to most tricyclic antidepressants and is thought to act as an atypical mu-opioid agonist. Euphoria is commonly experienced among users, as well as severe withdrawal symptoms following abrupt discontinuation. Tianeptine appears to typically be obtained as an ingredient in dietary supplements obtained off the web. One other substance, alpha-PVP, sometimes called flaca, gravel, or bath salts, is a synthetic cathinone that possesses stimulatory effects similar to cat, which we just discussed. It's thought to inhibit reuptake of dopamine and norepinephrine predominantly. Aggressiveness and hallucinations are also frequently reported in addition to its amphetamine-like effects. Toxic doses are unclear, but reports of extreme agitation, altered mental status, and self-harm are growing. Most drug screens, unfortunately, do not detect these emerging substances of misuse, and consideration of their use should be followed by a frank discussion with the patient of concern. This prescribing tip is brought to you by the Southern Illinois University Edwardsville School of Pharmacy and the Illinois Prescription Monitoring Program.